Are you or someone you love taking oxycodone for pain? This powerful opioid can be highly effective, but it also comes with serious risks if not used correctly. In today's video, we'll break down everything you need to know about oxycodone, how it works, common side effects, safe dosing, important precautions, and pharmacist tips to protect your health. Stay tuned to get trusted, science-backed answers before your next dose. What is oxycodone? Oxycodone is a prescription opioid medication, commonly known by brand names such as Oxycodone and Oxycodone. It is primarily used to manage moderate to severe pain when other non-opioid pain relievers are not effective. Oxycodone is available in immediate release forms, including tablets, capsules, and oral solutions. The immediate release form is usually taken every 4 to 6 hours as needed for pain control. Because oxycodone is a controlled substance, it carries a significant risk of misuse, dependence, and addiction if not used exactly as prescribed. Common side effects may include constipation, drowsiness, dizziness, and nausea. These effects can vary depending on the dosage and the individual's health condition. What is oxycodone used for? Oxycodone is prescribed for managing pain that cannot be adequately controlled with non-opioid medications alone. This makes it an important option for patients dealing with post-surgical pain, cancer-related pain, or other severe and persistent pain conditions. How does oxycodone work? Oxycodone works by binding to mu-opioid receptors in the brain and spinal cord. By activating these receptors, the medication changes the way the body perceives and responds to pain. This provides effective pain relief, but also explains why oxycodone has a high potential for misuse and addiction. What are the side effects of oxycodone? Oxycodone is an opioid medication widely prescribed for managing moderate to severe pain. While it can be effective, it also carries the risk of side effects that may range from mild to life-threatening. Understanding these side effects is essential for anyone taking this medication. Common side effects. Many people experience mild side effects when starting oxycodone. These often improve over time as the body adjusts, but if they persist or worsen, contact your healthcare provider. Common side effects include nausea and vomiting, constipation, itching, headache, dizziness or weakness, sleepiness or drowsiness, difficulty sleeping. Other possible side effects. Some individuals may also experience stomach pain, chills, diarrhea, cough, shortness of breath. Serious side effects. Oxycodone can cause severe, potentially life-threatening reactions. If you experience any of the following, seek medical help immediately. Dangerously slow breathing, trouble breathing, bluish lips, fingers, or toes. Overdose symptoms, unresponsiveness, slowed breathing, slow heartbeat, extreme sleepiness, or cold and clammy skin. Opioid withdrawal symptoms, anxiety, restlessness, irritability, runny nose, yawning, sweating, chills, or enlarged pupils. Serious allergic reaction, rash or hives, chest tightness, shortness of breath, or swelling of the lips, tongue, throat, face, or eyes. Oxycodone can be an important medication for managing severe pain, but it comes with significant risks. Always use it exactly as prescribed, and notify your healthcare provider about any concerning side effects. Oxycodone dosage forms. Oxycodone is available in several formulations, including tablets, capsules, and oral solutions. These options allow healthcare providers to select the most appropriate form depending on the patient's pain severity and medical condition. For example, oral solution bottles are available in different concentrations. 15 milliliters of 20 milligrams per milliliter solution. 30 milliliters of 20 milligrams per milliliter solution. Your prescriber will determine which dosage form is right for you based on your health status and pain management needs. Typical dosing for oxycodone. Dosage varies widely depending on the condition being treated and the individual's response. In most cases, providers recommend taking the lowest effective dose for the shortest duration possible to minimize risks. The typical starting dose for immediate release oxycodone is 5 mg to 15 mg by mouth every 4 to 6 hours as needed for pain. However, the exact dosage should always be individualized and carefully monitored by a healthcare professional. Oxycodone contraindications. Oxycodone is not safe for everyone. Certain medical conditions increase the risk of life-threatening complications. You should not take oxycodone if you have any of the following: severely slowed breathing, respiratory depression, severe or uncontrolled asthma, conditions that cause blockage of the stomach or intestines, a known allergy to oxycodone. Because oxycodone is a powerful opioid, it should only be used under the close supervision of a licensed healthcare provider. Oxycodone can provide effective relief for moderate to severe pain, but it must be prescribed carefully due to the risks of side effects, dependency, and serious complications. Always follow your provider's instructions and discuss any medical conditions or concerns before starting oxycodone. Pharmacist tips for taking oxycodone. Oxycodone is a powerful opioid prescribed to manage moderate to severe pain. To stay safe and get the most benefit from this medication, here are important pharmacist-recommended tips you should always follow. How to take oxycodone. Swallow immediate-release oxycodone tablets whole. Do not split, crush, or break them. Take one tablet at a time with plenty of water. If you're prescribed the liquid form, make sure you know the strength of your medication and measure your dose carefully. Always use the oral syringe provided by the pharmacy, not household spoons. Keep the liquid in its original container at room temperature, away from light. Safety precautions. Oxycodone can make you sleepy, dizzy, and affect your ability to concentrate. Avoid driving or operating heavy machinery until you know how the medication affects you. Do not drink alcohol while taking oxycodone. Mixing alcohol with opioids increases the risk of dangerous side effects, including severe drowsiness, confusion, and accidental injury. Take oxycodone exactly as prescribed. Do not change your dose or stop suddenly without your provider's guidance. Stopping too quickly can trigger withdrawal symptoms such as sweating, anxiety, restlessness, and trouble sleeping. Drug interactions. Always tell your prescriber about all the medications you're taking. Oxycodone can interact with certain antidepressants, benzodiazepines, and sleep medications, which may increase the risk of harmful side effects. Never start new medications without consulting your healthcare provider. Special considerations. If you're pregnant, let your prescriber know. Oxycodone is generally not recommended during pregnancy due to risks for the unborn baby. If you're breastfeeding, discuss alternatives with your care team. Oxycodone passes into breast milk and can cause drowsiness or slowed breathing in infants. Overdose preparedness. It's strongly recommended that patients prescribed oxycodone also keep naloxone, Narcan, on hand. Naloxone is a life-saving medication that can temporarily reverse an opioid overdose. Make sure your family or close contacts know where it is stored and how to use it, and always call emergency services if an overdose is suspected. Storage and disposal. Keep oxycodone stored securely, out of reach of children, pets, and visitors. If you no longer need the medication, use a take-back program or follow FDA-approved disposal methods to reduce the risk of accidental overdose or misuse. Oxycodone can be an effective treatment for severe pain, but it comes with serious risks. By following these pharmacist tips, you can use oxycodone more safely and responsibly. If you found this video helpful, don't forget to like this video, subscribe to the HeInfo channel, and share it with others who may benefit from trusted, science-backed health information. Stay informed, stay safe, and join us for more expert guidance on health and medicine.